So for this video, I'm going to determine the to assess the neurologic of our patient. So first things first, I'm going to inspect the level of consciousness to our patient. So I have here the personal information of my patient. So let's see if they're to determine the levels of consciousness. If it is alert, lethargic, somnolent, and then also obtended stuporous, and then also comatose. Alright, so I'm gonna ask the my client or patient some questions, personal questions. Sir, what is your name? Alright, so you can see that he is alert and very responsive. Alright, so your age, please.
13.
Then your birthday. Okay, who is the president of our in the Philippines? Alright, so we can see that our patient, the level of consciousness of our patient, he is alert, so it means that he is awake and very responsive. So it means our patient has a normal finding. Alright, so next is we are going to inspect the GCS of our patient, or the Glasgow Coma Scale of our patient. So we have this three, which is if it is our patient's eye opening with brisk response, and then if it is most appropriate verbal response, and then the integral motor response here in the arm. So sir, can you please close your eyes? Alright, then open, and then can you see this?
Ceiling fan.
It's a ceiling fan. So we can now determine that the spontaneous opening is number 4, the scale with 4, and then the how he verbalizes that being oriented, so 5. So on that, and then next is we are going to proceed the most integral motor response of our patient. So, sir, if I got kumukuan baka response baka, okay, kanang ana sir, okay, speak sa pod. Sige, ako kad ko anon ha, murag sumbagon, tapos ikaw dapat muli kay pagkaha if mo response baka. Okay, one trigger. Okay, may nang imong arm sir ato kanon mo arms, alright? Sige, so today. Ayan, today. Okay, balik. Okay, so we can see that our patient responses his arm, and then it is it obeys the verbal commands by using the arm. So with a scale of 6, so we can determine that it has a high score, which means alert ang iyang pagkuan. Alright, so let's proceed on the other. So it means our patient has a normal finding on the GCS, or the Glasgow Coma Scale. So next is we are going to inspect the mood and effect of our patient. So I'm gonna ask some questions, what mood or the effect on how our client has been in today. So sir, how are you today?
Fine.
You're fine. Is there any what mood do you have on it?
Default.
Before, alright. So I can see it that our patient he's been cooperative on what my question is, and that he expresses the feelings on what he has right now, what mood he has right now, and then the appropriate situation on it. So now we are going to proceed the dress and the hygiene, and then some grooming. So we can see it that he's appear in a neat way, and that appropriate clothes are on it, and then as far as the weather's today. So next is we are going to determine the facial expression of our patient. This is where to determine to note the eye contact of our patient. So sir, can you please eye contact on me, and then so sir, smile. Alright, and then sadness, angry. Okay, so I can see it, and then sir, frown, just frown. So I can see it that it is maintained in a good eye contact on me, and then he smiles at what I'm also said, and then he frowns appropriately after what I said. And then we are going to determine the speech, and then to note the tone, the clarity of our patient. So sir, can you please talk something about like say hi.
Hi.
Okay, so I can see it. I can determine that it is a moderate tone and then clear. Again, so sir, can you please hi, let's say just introduce yourself.
Hi.
Introduce yourself.
I am
Okay, so it is in moderate tone and then clear and then with a moderate pace. So and then the vocabulary is what I would expect and then I'm going to point something. So what is this, sir?
t-shirt.
A t-shirt and then this one,
Stethoscope.
this one,
Paper.
so paper or let's say a newspaper. All right. So what is this? This one.
Camera.
And a camera. Alright, so our patient or client names a familiar objects and then there are without no difficulty and then he reads some age appropriate letters written in print and then coherent sentence also and then also correct spelling and grammar. Alright, so our patient also taught a process and then expresses some full and then free flowing. So, so next is we are going to proceed on a finger nose test of our patient. So I'm going to open some alcohol, some one of my private ask him also. If he can clear his answer, I'm gonna put some here. Okay. So may makasimot ba ka, sir? Yes. Sa may mo makanan. Just sir. Explain on what you test. Explain it. Medyo naman kusog uy lang ang baho na. So we can also determine our patient's nose is okay and then he can smell something mansad and then also we are going to assess if it is he can run ba sige sir daga sir just in the place. Okay, so I can see it nga I'm just here I'm standing and then watching his heel if it is so appropriate naman sad and then he runs each heel smoothly and then also down to each chin. Then also we are going to determine if he can walk. So sir, alright, so he can walk also with his toes and then also I'll gonna consider if kanang anaunti ka if sakit ba maka-feel ba ka o sakit. Okay.
Yes.
Sakit? Right, okay. So, can you sir, kuhan ba siya? Light ba siya? Sir. Wala na? Light ra? Bugat dili? Okay, so it is light. He can also know it. And then also, our patient can feel it. And then, correctly can feel it. Then also, we are going to determine sa finger niya dapit kung masakitan niya gihapon siya. So, finger lang ka, sir. Okay. Okay, sir. Okay. Okay. So, alright. So, more to say and then some neurologic assessment, some simple neurologic assessment for our patient. So that's it, and then our patient has a normal finding overall. So thank you and God bless.